May is Stroke Awareness Month, and according to the National Stroke Association, the first line of defense against heart rhythm conditions like AFib is knowing your own pulse. And here to explain is the founder, CEO, and trustee of the Arrhythmia Alliance and AF Association, Trudy Lobin. It's great having you.
Thank you, and thank you for giving me the opportunity to ensure that your viewers become pulse rhythm aware.
Absolutely. Let's begin into this. Let's talk about atrial fibrillation, or AFib as it's often called. First of all, how do you know if you even have it in the first place?
So for some people, they will have symptoms of atrial fibrillation, AFib. They will have the pounding in their chest, like their heart's going to explode through their chest, or they may feel it's like a bag of worms wriggling around. The palpitations, the exhaustion, the fatigue, especially when climbing stairs and walking. Wow. For others, there are no symptoms, the silent AF. And some people are permanently in AFib, and for others, they may be in it daily, weekly, monthly. It comes and goes. And so it's more harder to detect and diagnose. And hence the reason why it's so important that all of us get to know our pulse, to know our heart rhythm.
Absolutely. So you say to take note of our heart rhythm and pulse. What should we be paying attention to? How should we take notes about what we're experiencing?
Well, first and foremost, go to knowyourpulse.org, where you can watch video, you can get all the information, you can contact us. It is so simple. It's 3 fingers on your wrist. Get to know where you can feel your pulse. And then, many of us know our heart rate, but is our heart in rhythm? Is it beating steadily? Mm-hmm. Or is it jumping about? Is it too fast? Is it too slow? Is it irregular? And it's important. If that is happening, then we need to be talking to our healthcare professional. Absolutely.
What are the risks associated with AFib?
So main risk associated with AFib is stroke, because when the heart is quivering, a blood clot can form, and that clot can break away and travel from the heart to the brain. Yes, our hearts and brains are connected, yeah. And that can cause the most devastating and most common form of stroke, an AF-related stroke. Mm. Wow. AF-related strokes are often more debilitating, more disabling, and often fatal.
My goodness. Is there a certain age where we should be paying more attention to AFib, issues with our pulse, or does this happen at any age?
So, everyone, young, old, should all be pulse rhythm aware. Gotcha. We teach children in schools how to take their pulse, to know their rhythm. But as you get older, your risk of developing AFib increases as well. So it is important for all ages, and AFib is more common in the elderly. But getting it diagnosed is the important thing. And so, as well as an EKG, there's the latest technology, the iRhythm Zeo patch, which literally continuously monitors for 14 days. Wow. And can detect AFib. And that information is available at irhythmtech.com.
My goodness. So if you're feeling any of these feelings that we were mentioning earlier, you can go to your doctor, possibly get one of these, and that will be able to tell whether or not you have AFib, hopefully nip it in the bud before it becomes a more serious issue. That's pretty incredible.
Absolutely. Absolutely, yes.
What can we do with the diagnosis from there? We have about 30 seconds left. What can we do if we were diagnosed with AFib?
Once you have the diagnosis of AFib, you then need to make sure, A, you're anticoagulated to reduce the risk of an AF-related stroke and clots forming, and discuss with your doctor the various treatment options.
Awesome. It's great having you. Thank you so much for joining us. Catch AFib early and know your pulse. If you want to learn more, visit irhythmtech.com. iRhythm is a proud sponsor of The Morning Blend.